I did my journal review on the validity, reliability, and ability to identify fall status in patients with COPD. Before I get into the study, I just wanted to give you guys a little bit of background information on what COPD is. So it stands for chronic obstructive pulmonary disease. Some of the most common you'll hear about are chronic bronchitis, emphysema. Bronchitis is increased mucus and inflammation, while emphysema is more of a destruction and enlargement of the air sacs in our lungs. It's essentially the deterioration of pulmonary function. This is going to decline our patient's functional performance, which is where we step in to help treat and provide care. Due to this decreased pulmonary function, it's going to lead to high risk for falling. So approximately 30 to 50% of patients with COPD fall at least once during a 6 to 12-month period. I put a picture down here at the bottom for you guys of a healthy lung and a lung with COPD, just so you can see how severe it can really get. Since the study was about being able to identify fall status in patients with COPD, they administered balance tests throughout the study. These are the 4 big ones that they used. So the Berg Balance Scale, or the BBS, 14 items that assess one's performance on specific functional tasks, scored from 0 to 4, so the higher the score, the better the balance performance was. Another one they used was the Balance Evaluation Systems Test, or the BEST test. This is 36 items organized into 6 different subsections, which are broken down into biomechanical restraints, stability limits, and verticality, postural responses to external perturbations, sensory orientation during stance, and stability in gait. These were also graded, but this was from 0 to 3, 0 being severe balance impairment and 3 being no balance impairment. And again, the higher the score, the better the balance. And then they have 2 different little tests that come off of the BEST test, like a little branch. So the mini and the brief. So the mini is only 14 items from sections of the BEST test, but it's more aimed towards postural adjustments and postural responses. This is only scored from 0 to 2. And then the brief BEST test is 6 items, so it's 1 from each of those 6 subsections. This one scored 0 to 3, and again, for both of these, the higher the score, the better the balance performance was. So here's some of the criteria that had to be met to participate in the study. They had to be clinically stable for 1 month prior to the study, so no hospital admissions. The study was conducted in the older population, so 6 years or older, with a diagnosis of COPD. Participants were excluded if they had any type of diagnosis with asthma, dementia, osteoarthritis, schizophrenia. They didn't want any of those conditions to interfere with measurements. And then all of the participants were provided with a clear definition of what a fall is. So they defined it as an event where you find yourself unintentionally on the ground or floor. And then they assessed whether the patients had a history of falls or not. So they asked them 2 different questions. The first was, have you had any falls in the last 12 months? And then they asked them, how many times did you fall in the last 12 months? So if they answered yes to falling within the last 12 months, then they were considered to have a history of falls. So the study ended up having 46 participants with an average age of 75 years old. They split them up into 2 different groups, so patients with a history of falls and without a history of falls. They measured their lung function with a spirometer to determine the severity of their COPD. So 28% of them had mild, 45% had moderate, and 26% had severe COPD. They were then given a series of questionnaires and scales to fill out. So the MMRC is the Modified Medical Research Council, and this was used to assess disability resulting from dyspnea, which is difficulty breathing. And the higher the grade they received, the greater their respiratory limitation was. The ABC scale was also used. This is the Activity-Specific Balance Confidence, and this was used to perceive the ability to maintain balance under different circumstances. The last part of the study was balance tests being administered by 2 different physical therapists, and they divided them up into sections. So the first session was 2 physical therapists rating the participant's performance independently. So one provided instruction to the participant while the other one demonstrated. Then they had the participant perform the task with close supervision, and then each task was scored immediately upon completion by both of the PTs. Session 2, the participants were reassessed by one of the two PTs after a 48 to 72-hour interval, and efforts were made between these two sessions to keep factors as consistent as possible. So they tried to keep the time of the day and the location where the balance test was performed the same. The study was found to have very successful results. They broke it up into 3 different sections: the ability to identify fall status, the reliability of the balance test to identify fall status, and then the validity between the balance test. So all 4 tests administered were able to differentiate between participants with and without a fall history. They had inter-rater and intra-rater results for reliability. So the inter-rater results were from that session 1 that I was telling you about on the previous slide, and the intra-rater results were from session 2. So excellent inter-rater reliability was observed for all balance tests. The BBS had moderate to good intra-rater results, while all other balance tests had excellent results. As far as validity goes, they found that the relationship between all the balance tests was strong, and they were all appropriate to administer during the study. Typically, a study like this is done in patients with Parkinson's disease or someone who's had a stroke. This is the first time a study was done to investigate something like this in patients with COPD. I think there's a few things they could have done differently. So they didn't specify on how long the study was conducted. After I was done reading the article, it sounded like to me they only did those 2 sessions. And personally, I think that something like this should be done over a series of weeks so they can get their information and results as accurate as possible. And then I wish they would have gave more info on what tasks were performed. So they told us what balance tests they used, but I wish they would have dove deeper into what exactly they had their patients doing during the study. Overall, though, I think it was a great start to this investigation. This was done back in 2013 and 2014, so I would love to see if there's more research done on it today and if the results are different or not. And then as far as how it relates to us, I think this is very crucial in our field. So if you have the ability to identify fall status in patients with or without COPD, I think that's great to be able to do. If we can use these balance tests to do that, then I think we should take advantage of that. As clinicians, we're always going to want to protect our patients, keep them safe, make them feel comfortable, and wanting to keep coming back to PT so that they can, get healed. So if we can detect that risk of falling before the fall occurs, I think that's so awesome. And I hope you guys can appreciate that. And I hope you can take something away from this. And thank you so much for listening.